Hi friends, my name is Dr. Keke and today we'll be discussing pelvic inflammatory diseases. Pelvic inflammatory disease is simply the infection of the female genital organs. The pelvis is localized at the lower abdomen and it houses the uterus, it houses the cervix, it houses the ovaries and the fallopian tubes. Now, amongst many germs that causes this infection, pelvic inflammatory disease, the sexually transmitted disease, that the germs that causes it is part of it, such as Neisseria gonorrhea and chlamydia. Now, when we talk about risk factors for PID, if you are below 25 years of age and you have sexual intercourse, you are prone to have PID. If you have sexual intercourse without a condom, or if you have multiple sexual partners, you tend to come down with pelvic inflammatory disease. Now, if you are making use of an intrauterine device, IUD, to prevent pregnancy, you are prone to have the infection. Now, let's talk more about the symptoms. What are the symptoms? Now, most women will complain of having low abdominal pain. That's the majority of symptoms that you may present with. Low abdominal pain. Sometimes they may come down with fever. Sometimes they may come down with nausea or vomiting. Now, the pain can be very sharp, described as sharp abdominal pain. Now, sometimes they can also come down with irregular bleeding during their menses, and some other nondescript symptoms. Now, how do we treat? When you see your doctor, he will want to examine you to find out exactly where these symptoms are coming from. For instance, you want to check your pelvic area to localize the pain. Now, he may also want to go ahead and carry out some tests, such as endocervical swab tests. In this case, you just put a small swipe of the cervix to find out the germ that is causing it. Now, he may also want to do a scan, a pelvic scan, to find out if there are connections in your area, in your pelvic area. Now, there are some other blood tests that can help him to tie down the infection, the diagnosis of the infection. Now, there are some other specialized tests such as laparoscopy. That simply means putting a lens through a hole, a pinpoint hole made through your abdomen to have a look at your pelvic organs. Now, how do we treat? Your doctor would like to make use of antibiotics because he's not sure which germ, and because some of the tests, like the swab tests, may take a couple of days. He will want to start you up on at least 2 different antibiotics or even more. Now, we also want to give you painkillers to reduce the pain, antipyretics to reduce the fever, anti-nausea drugs to reduce the vomiting and the nausea. Okay. Now, what about prevention? How do we prevent pelvic inflammatory disease? Simply go straight to the causes or the risk factors. If you have multiple sexual partners, it doesn't pay you. So stick to one partner. And also try to practice safe sex. Use the condom. Now, if you are prone to have pelvic inflammatory disease, of course there's a tendency, a greater percentage for you to have a recurrent infection. You may want to discuss with your doctor with respect to the type of family planning you are making use of, particularly the IUD. If you are prone to have pelvic inflammatory disease, then you may not want to use the IUD. What about your partner? You may want to treat your partner as well. In other words, to prevent it. Yes, this is the reason why it's important for you to have one sexual partner. That way you can easily handle the effect. You treat yourself and your partner also get treated as well. Now, what are the prognosis? Or rather, what are the complications before prognosis? Pelvic inflammatory disease is one of the major causes of infertility in women. And as such, it should be taken with caution, to be treated with care. Most young ladies, before the time of marriage, they may come down with the symptoms of pelvic inflammatory disease, such as the severe lower abdominal pain, such as the abnormal vaginal discharge or foul-smelling discharge, and they do not tell anyone. They simply go across the street and buy some drugs from the chemist. That is wrong. Pelvic inflammatory disease can actually make you not to take it, not to give birth, and because of that you need to see a doctor on time so that you get treated. If you have any of these symptoms, it's important to promptly see the doctor and get treated. The complications again include chronic pain, recurrent pain, chronic pain over periods of weeks, months, or even years. Now, infertility is the major complication, and this is the reason why it needs to be treated effectively by a doctor. Now, the third one could also be scarring. Can cause some scarring in your tubes, in your ovaries, and of course this will lead to the infertility. Now, what's the prognosis? What's the outlook? If it's detected on time and treated, fine and good. If it's not detected on time, the chances of reoccurrence is there, and the chances of causing scar to your womb and to the tubes is quite high. More than 10% of women presently that have infertility is because of the pelvic inflammatory disease, and more than 6% of women that have chronic pelvic pain is because of pelvic inflammatory disease. So in summary, do the best you can. If you have any of the symptoms like we mentioned earlier on, see your doctor. Thank you for your time. For more health talks, please subscribe with us on our various social media handles. Until we meet again, stay healthy, Naija.